Pregnancy, right. It's full of surprises, mood swings,
Yeah.
cravings, and apparently sometimes even hyperthyroidism.
Yeah.
Today, we're going deep on how pregnancy can sometimes make your thyroid go a little haywire.
That's right.
We'll be looking at a medical paper that really digs into hyperthyroidism during pregnancy.
Okay.
It's like a medical detective story,
Ooh, I like that.
figuring out what it is, how often it happens, and what clues to look for.
I love a good medical mystery.
Yeah.
Okay, so first things first, can you give us a quick refresher on what hyperthyroidism actually is?
Absolutely.
Okay.
It basically means your thyroid,
Mhm.
that butterfly-shaped gland in your neck,
Right.
is a bit of an overachiever.
Mhm.
It's producing way more hormones than your body actually needs.
Okay,
And that can throw things out of whack.
got it.
Yeah.
And I know our hormones are already on a roller coaster ride during pregnancy.
Yeah.
How is this different from the normal thyroid changes that happen?
Good point.
It's true that thyroid hormones naturally go up and down throughout pregnancy,
Right?
but they usually stay within a healthy range.
Okay.
Hyperthyroidism is when those levels get significantly elevated.
Mm-hmm.
Think of it like the volume dial getting cranked up way too high.
Okay.
Yeah.
So how common is this overachiever thyroid during pregnancy?
Well,
Should I be worried?
the good news is that true hyperthyroidism only pops up in about 0.1 to 0.4% of pregnancies.
Okay.
But,
Yeah.
and this is a big but
Yeah.
even though it's relatively rare, it can cause some serious problems if it's not managed properly.
Gotcha.
That's why we're here to arm you with the knowledge.
Okay, that makes me feel a little better.
Yeah.
But I have to admit,
Yeah.
I'm already feeling hot and sweaty,
Yeah,
and my heart is racing.
right.
Isn't it like normal for pregnancy?
It is.
Yeah.
And that's what makes hyperthyroidism so tricky to spot during pregnancy.
Oh.
Many of the symptoms, things like that rapid heartbeat, feeling hot,
Mm-hmm.
sweating more than usual,
Mhm.
those can all mimic a normal pregnancy.
Oh, man. So how on earth are you supposed to know if it's just pregnancy being pregnancy
Yeah.
or if something else is going on?
You've got to play detective.
Oh.
Look for the subtler clues.
Like what?
Think unexplained anxiety, hand tremors,
Okay.
like your hands are shaking a bit,
Mm-hmm.
or even losing weight when you're eating normally,
Oh, wow.
or even more than usual.
So on top of the fatigue and cravings, I got to watch out for anxiety and weight loss.
Well,
Pregnancy is a real trip.
yeah.
But seriously,
Yeah.
are there any obvious signs that it's definitely hyperthyroidism?
There are a couple of red flags that usually point specifically to a type of hyperthyroidism called Graves' disease.
Okay.
If you notice a goiter that's an enlarged thyroid gland,
Right.
or any problems with your eyes,
Okay.
like bulging or difficulty moving them,
Got it.
those are definite signs to get checked out ASAP.
Goiter or eye issues, call the doctor.
Yes, exactly.
So you've mentioned a few times that uncontrolled hyperthyroidism can be dangerous during pregnancy.
Yeah,
What are we talking about here?
sure.
What are the risks?
Unfortunately, the list is pretty long,
Yep.
which is why catching it early is so important.
Right.
For the baby,
Mm-hmm.
it can increase the risk of miscarriage,
Oh, wow.
premature birth, low birth weight, stillbirth,
Oh, gosh.
and even developmental problems down the road.
Yeah.
And for
Right.
you, it can lead to preeclampsia,
Okay.
which is a dangerous condition involving high blood pressure
Right.
and in really severe cases, even heart failure.
Wow. Okay. Definitely not something to mess around with.
No.
So how do they even figure out if you have hyperthyroidism during pregnancy?
Wow.
Is it just a simple blood test?
Blood tests are definitely the first step.
Okay.
But there's a little more to it than that because hormone levels naturally change during pregnancy.
Right.
Doctors have to interpret your results based on specific ranges for pregnant women.
So what might be a normal thyroid level for me before pregnancy could actually be a red flag now.
Exactly.
Wow.
The most important test they look at is for TSH,
Oh.
which stands for thyroid stimulating hormone.
Hmm.
A very low TSH, we're talking a level below 0.1 MIUL, is usually a strong indicator of hyperthyroidism,
Got it.
even if other hormone levels might look normal at first glance.
Okay, so low TSH, possible hyperthyroidism.
Right.
What happens next?
That's when the real detective work begins. If your TSH is low,
Mm-hmm.
doctors will order more tests to figure out exactly what's causing the hyperthyroidism.
Okay.
And this is crucial
Yeah.
because the cause determines the best course of treatment.
Right.
It's like solving a puzzle,
Yeah, like
and
me.
every piece matters.
Oh, I love a good medical mystery.
Yeah.
So what are the usual suspects when it comes to hyperthyroidism in pregnancy?
Our paper points to two main culprits.
Okay.
Graves' disease, which is an autoimmune disorder,
Right.
and HCG-mediated hyperthyroidism.
Okay. Which is triggered by, you guessed it,
Uh-huh.
the pregnancy hormone HCG.
Okay, so two very different causes.
Yes.
Potentially, with very different treatments.
Right.
Let's break them down.
Yeah.
Starting with Graves' disease.
Okay.
What's the deal with that one?
Graves' disease is an autoimmune condition.
Okay.
Which means your immune system is basically attacking your own body.
Right.
In this case, the target is your thyroid gland.
Okay.
And remember those red flags we talked about?
Mm-hmm.
The goiter and eye issues?
Right.
Those are strong clues that it might be Graves.
Got it.
Along with specific blood tests that look for antibodies attacking the thyroid.
Right. Right.
Yeah.
Attacking the thyroid.
Yeah.
Now, I think you mentioned earlier that Graves' disease might actually get better during later pregnancy.
Yeah.
That seems counterintuitive.
It is a bit strange.
Yeah.
But it seems that for some women, the immune system kind of chills out a bit during pregnancy.
It's like a dimmer switch gets turned down on the autoimmune attack.
Okay.
But here's the catch.
Okay.
After you give birth, as your immune system revs back up,
Right.
those attacks can come back with a vengeance.
Oh, wow.
Yeah.
So it's not necessarily gone for good, just on a temporary break.
Exactly. And that's something to keep in mind when we talk about treatment options later on.
Okay, noted.
Yeah.
So that's Graves' disease.
Right.
What about the other one?
Yeah.
The HCG-mediated hyperthyroidism?
Okay.
What's happening there?
Well, in this case, the culprit is HCG,
Right.
the hormone that's basically the VIP of pregnancy.
Okay.
Usually it's doing all sorts of good things to support your growing baby,
Right.
but sometimes it can act like that overzealous employee who takes things a bit too far.
Uh-huh. Okay.
Yeah.
I'm intrigued.
Yeah.
How does HCG go from pregnancy hero to thyroid troublemaker?
It's a bit complicated.
Okay.
But basically, high levels of HCG can actually stimulate the thyroid directly,
Got it.
causing it to pump out too much hormone.
Okay.
It's like HCG accidentally stepped on the gas pedal of your thyroid,
I like that analogy.
making it go into overdrive.
Gotcha.
Yeah.
So it's not that HCG is bad.
Right.
It just gets a little overenthusiastic sometimes.
Exactly.
But how does that actually play out?
Yeah.
Are there different types of HCG-related hyperthyroidism?
There are. Our paper talks about three main scenarios.
Okay.
The first one is called gestational transient thyrotoxicosis,
Okay.
or GTT for short.
Got it.
And it's like a quick blip on the radar.
Uh-huh.
It's usually mild and resolves on its own as your HCG levels naturally start to drop later in pregnancy.
So kind of like a hormonal hiccup.
Exactly.
Nothing to worry about.
Exactly.
Okay.
Then there's hyperemesis gravidarum,
Okay.
which you might know as that extreme morning sickness that goes way beyond a few saltines.
Oh, yeah, I've heard horror stories.
Well, hyperemesis gravidarum is often linked to sky-high levels of HCG. And while it doesn't always lead to full-blown hyperthyroidism, it can cause very similar symptoms.
Okay.
So if you're struggling with really severe morning sickness, it's worth getting your thyroid checked out too.
Noted.
Good.
So we've got the fleeting GTT, the super intense morning sickness. What's the third scenario?
This one's a bit rarer and more serious.
Okay.
It's called trophoblastic hyperthyroidism, and it's associated with conditions like a molar pregnancy.
A molar pregnancy.
Yes.
I've heard of that, but don't really know what it is.
It's when things go a bit awry with the development of the placenta.
Okay.
In some cases, it's benign and resolves on its own.
Right.
But in other cases, it can lead to a type of cancer called choriocarcinoma.
Oh, wow.
So trophoblastic hyperthyroidism is definitely something doctors monitor very closely.
Okay, so two of these HCG-related scenarios seem to resolve on their own.
Yeah.
But that last one sounds pretty intense.
It can be, yes.
But back to the big picture for a second.
Yeah.
We've got Graves' disease and HCG-related hyperthyroidism,
Right.
both potentially causing similar symptoms.
Right.
How do doctors actually tell them apart?
It's all about those detective skills again.
Okay.
Doctors use specific blood tests to differentiate between the two.
Got it.
For Graves' disease,
Yeah.
they look for TSH receptor antibodies in your blood.
Remind me again, what are those?
Those are the antibodies that are mistakenly attacking your thyroid.
Got it.
It's like finding their fingerprints at the scene of the crime.
Okay.
They also look at your T3 levels, which is another thyroid hormone, because that can sometimes help distinguish between Graves and HCCG-mediated hyperthyroidism.
So it's not always a simple diagnosis.
You got it.
Okay.
It can be a bit of a puzzle,
Yeah.
but there are ways to get to the bottom of it.
What about imaging?
Sure.
Can doctors use ultrasound to see what's happening with the thyroid?
Absolutely.
Okay.
Ultrasound is a super helpful tool,
Yeah.
especially for differentiating Graves' disease,
Right.
which usually shows increased blood flow to the thyroid
Okay.
from certain types of thyroiditis where blood flow is actually decreased.
Got it.
It's like seeing the traffic jam caused by all that extra thyroid activity.
I like that.
Yeah.
Okay, I'm getting a much clearer picture of how doctors diagnose these different types of hyperthyroidism.
Oh, good.
Now let's talk about treatment.
Okay.
This is where things get really real for a lot of people.
Yeah.
Especially pregnant women.
Absolutely.
That's the options.
You're right. Treatment during pregnancy is a whole other level of complexity.
Okay.
It's all about finding that perfect balance between managing your hyperthyroidism and keeping your baby safe.
Mm-hmm.
The approach really depends on a few factors.
Yeah.
The severity of your hyperthyroidism,
Okay.
the specific cause,
Got it.
how far along in your pregnancy you are,
Gotcha.
and of course your personal preferences.
Mm-hmm.
It's a team effort between you and your doctor.
So there's no one-size-fits-all approach. Makes sense.
Yeah.
Let's start with Graves' disease.
Okay.
What's the typical treatment during pregnancy?
For Graves' disease,
Yeah.
the first line of treatment is usually anti-thyroid medications.
Okay.
These medications work by blocking the thyroid from producing too much hormone, kind of like putting a gentle brake on that overactive thyroid.
Okay. But I know a lot of people are wary of taking any medications during pregnancy.
Yeah.
Are these drugs safe for the baby?
I hear you. It's a totally valid concern.
Right.
And one that doctors take very seriously.
Oh, wait.
The good news is that there are certain anti-thyroid medications with a long track record of safety during pregnancy.
Okay.
But the key is using the lowest effective dose
Got it.
to minimize any potential risks to the baby.
So it's all about finding that sweet spot,
Yes.
controlling the hyperthyroidism while keeping the little one safe.
Exactly.
Okay.
And close monitoring is key throughout the pregnancy
Right.
to make sure the dosage is just right. Your doctor will regularly check both your thyroid hormone levels and your baby's to make adjustments as needed.
Now, what about those HCG-related cases?
Okay.
Do they use antithyroid medications for those as well?
Again, it depends.
Okay.
Remember GTT?
Yeah.
That mild, temporary one?
Right, the hormonal hiccup?
Yeah, exactly.
Yeah.
Since it tends to resolve on its own, medication often isn't necessary.
Okay.
It's like a brief storm that passes without causing too much trouble.
Got it.
Yeah.
Okay, that makes sense.
Right.
But what about those more severe forms of HCG-related hyperthyroidism,
Okay.
like the ones linked to molar pregnancy?
In those cases,
Yeah.
antithyroid medication might be needed
That's
to manage the symptoms and prevent complications.
Right.
But treating the underlying condition, like the molar pregnancy,
Right.
would also be a top priority.
Got it.
It's like tackling the root of the problem,
Yeah.
not just the symptom.
So there's a multi-pronged approach.
Exactly.
Are there any other treatment options besides medication?
There's one more option,
Okay.
but it's usually a last resort.
Okay.
In very rare and severe cases, surgery to remove part or all of the thyroid gland might be considered.
Whoa, that sounds pretty drastic.
It is.
When would surgery even be on the table?
Surgery is usually reserved for situations where medication hasn't been effective,
Right.
or if there are concerns about potential side effects of the medication
Yeah.
for either you or the baby.
Okay.
It's not a decision that's made lightly.
I can imagine. It sounds
Yeah.
like all treatment decisions really involve a careful weighing of the risks and benefits.
Absolutely.
Okay.
And open communication between you and your doctor is super important throughout the whole process.
Okay, so we've talked about diagnosis and treatment for hyperthyroidism during pregnancy.
Yeah.
What about after the baby is born?
Okay.
Does everything just go back to normal?
That's a great question.
Yeah.
And the answer, unfortunately, is it depends. For many women with Graves' disease, their symptoms might actually improve during pregnancy.
Right.
Remember that immune system chilling out we talked about?
Yeah, the dimmer switch.
Yeah, exactly.
Yeah.
Only to flare up again after delivery.
Wait, seriously?
Yeah.
So it's like a temporary reprieve, not a cure.
Think of it as that immune system dimmer switch getting turned back up.
Oh, wow.
After delivery, as your body recovers and hormones readjust, those antibodies might start attacking your thyroid again,
Okay.
leading to a resurgence of symptoms.
So even if you feel better during pregnancy, you could still face challenges postpartum.
That's right.
What about for women with HCG-related hyperthyroidism?
Yeah.
Do their symptoms usually go away after delivery?
Yes. Typically, once those HCG levels drop after delivery,
Yeah.
their symptoms usually resolve.
Okay.
It's like the source of the thyroid overdrive has been removed.
Got it.
Yeah.
It's good to hear.
It is good news.
But even if your symptoms improve,
Yeah.
do you still need to monitor your thyroid after delivery?
Absolutely.
Okay.
Close monitoring is essential for all women with a history of hyperthyroidism during pregnancy,
Okay.
regardless of the cause.
Got it.
This helps make sure any lingering issues are caught early
Right.
and any necessary treatment adjustments are made.
Mm-hmm.
It's all about staying proactive and advocating for your health.
That's great advice.
Thank you.
So we've covered a lot of ground.
Yeah, we have.
But it sounds like the key takeaways here are that hyperthyroidism during pregnancy can be tricky,
Right.
but it is treatable.
Yes.
Anti-thyroid medications are usually the first line of defense,
Exactly.
but other options like surgery are sometimes considered.
Right.
And don't forget the importance of ongoing monitoring, both during and after pregnancy.
Absolutely.
Right.
Very important.
Monitoring is key.
Okay.
Now, before we wrap up this part of our deep dive,
Yeah.
I have one more question.
Okay.
Our paper focuses on Graves' disease and HCG-mediated hyperthyroidism. But I'm curious.
Yeah.
Are there any other factors that could potentially affect thyroid function during pregnancy?
Yes.
No. Okay.
Definitely.
You know, for those of us who like to connect the dots and see the bigger picture.
Absolutely. It's like we've uncovered the main suspects in our thyroid mystery, but I'm wondering if there are any other accomplices lurking in the shadows.
Okay. Yes. Spill the beans.
Okay.
What else should we be thinking about?
Well, for starters, there's the whole nutrition angle.
Okay.
We know that getting enough iodine is essential for a healthy thyroid.
Right.
And during pregnancy, your body needs even more of it
Okay.
to keep up with the demands of growing a tiny human.
Makes sense. You're basically building a whole new person from scratch.
Exactly.
Yeah.
So making sure you're getting enough iodine through your diet or prenatal vitamins is super important.
Okay.
It's like giving your thyroid the building blocks it needs to function properly.
Okay. Iodine.
Okay.
Check. What else is on the list of potential thyroid influencers?
We've talked a lot about HCG.
Right.
But don't forget about estrogen and progesterone.
Oh, right. Okay.
Those hormones are also surging during pregnancy.
Yeah.
And they can actually influence how much thyroid hormone your body produces and how it uses those hormones.
It's like a whole hormonal orchestra in there.
It really is.
Yeah.
And each instrument has its part to play.
Right.
Then, of course, there's genetics.
Okay.
Some women may have a genetic predisposition to thyroid problems, which can be amplified by the hormonal shifts of pregnancy.
Yeah.
It's like having a family history of drama.
Right.
Sometimes you just can't escape it.
Wow. So it's this intricate web of genetics,
It is.
hormones, and even what you eat.
Yeah,
It's no wonder things can get a little complicated.
that's right.
Yeah.
And that's why it's so crucial to have open and honest conversations with your doctor throughout your pregnancy. They're like your personal thyroid detective,
Okay.
helping you monitor things, spot any potential red flags, and create a treatment plan that's tailored to your specific needs.
Couldn't have said it better myself.
Thank you.
So as we wrap up our deep dive into hyperthyroidism during pregnancy,
Yeah.
what are the key takeaways for our listeners?
I think the biggest takeaway is awareness.
Okay.
Hyperthyroidism during pregnancy is uncommon,
Right.
but it can have serious consequences if it's not caught and treated properly.
Right.
And because the symptoms can often mimic normal pregnancy woes,
Yeah.
it's essential to pay attention to your body and speak up if anything feels off.
Right. Early detection is key.
Exactly. And
Yeah.
remember, there are effective treatment options available, whether it's medications
Right.
or, in rare cases, surgery.
Right.
The important thing is to work closely with your healthcare provider
Sure.
to determine the best approach for you and your baby.
We've covered a ton of information today.
Yeah,
But this is really just the beginning of your learning journey.
that's right.
Keep asking questions.
Yeah.
Keep digging deeper.
Ex-
And don't be afraid to advocate for your health.
Absolutely.
Knowledge is power.
Well said.
Thanks for joining us on this deep dive into hyperthyroidism during pregnancy.
It was my pleasure.
We'll see you next time for another fascinating exploration into the world of health and wellness.
Looking forward to it.
Until then, stay curious, stay informed, and stay well.
You're thinking like a true detective, and
Yeah.
you're absolutely right.
Okay.
There are other factors that can play a role in thyroid function during pregnancy.
Okay.
It's not always a simple case.
So, like what?
Well, for starters,
Right.
there's the whole nutrition angle.
Okay.
We know that getting enough iodine is essential for a healthy thyroid.
Right.
And during pregnancy, your body needs even more of it
Right.
to keep up with the demands of growing a tiny human.
Makes sense.
Yeah.
You're basically building a whole new person from scratch.
Exactly.
Yeah.
So making sure you're getting enough iodine through your diet or prenatal vitamins is super important. It's like giving your thyroid the building blocks it needs to function properly.
Okay. Iodine. Check. What else is on the list of potential thyroid influencers?
We've talked a lot about HCG.
Yeah.
But don't forget about estrogen and progesterone.
Right.
Those hormones are also surging during pregnancy, and they can actually influence how much thyroid hormone your body produces and how it uses those hormones.
So it's like a whole hormonal orchestra in there.
It really is.
It really is.
And each instrument has its part to play. Then, of course, there's genetics.
Right. Okay.
Some women may have a genetic predisposition to thyroid problems, which can be amplified by the hormonal shifts of pregnancy.
Right.
It's like having a family history of drama.
Yeah, exactly.
Sometimes you just can't escape it.
Wow. So it's this intricate web of genetic hormones and even what you eat.
Yeah, it really is.
It's no wonder things can get a little complicated.
It's true.
Yeah.
And that's why it's so crucial to have open and honest conversations with your doctor throughout your pregnancy. They're like your personal thyroid detective, helping you monitor things, spot any potential red flags, and create a treatment plan that's tailored to your specific needs.
I like that, yeah.
Good.
So as we wrap up our deep dive into hyperthyroidism during pregnancy, what are some key takeaways for our listeners?
I think the biggest takeaway is awareness.
Okay.
Hyperthyroidism during pregnancy is uncommon.
Right.
But it can have serious consequences if it's not caught and treated properly.
Right.
And because the symptoms can often mimic normal pregnancy woes, it's essential to pay attention to your body and speak up if anything feels off.
Early detection is key.
Exactly.
Yeah.
And remember, there are effective treatment options available, whether it's medications or, in rare cases, surgery.
Okay.
The important thing is to work closely with your healthcare provider to determine the best approach for you and your baby.
Awesome.
Yeah.
Well, this has been super fascinating.
It has.
And I've learned so much.
Good, me too.
I feel like we've really covered everything.
Yeah, I think so.
About hyperthyroidism during pregnancy.
I think we did a good job.
But I always like to remind our listeners
that
this is really just a starting point.
Exactly.
It's so important to continue learning and to advocate for your own health.
And agree more.
So keep asking questions.
Yes.
Keep researching.
Absolutely.
And don't be afraid to speak up for yourself.
Very important.
Thank you so much for joining me on this deep dive into hyperthyroidism during pregnancy.
It was my pleasure. I really enjoyed it.
It was great having you.
Thank you.
Until next time, stay curious, stay informed, and stay well.